When you hear the term psychedelics, you might think of hallucinogenic and mystical experiences. Popular psychedelics include LSD, magic mushrooms, and DMT, all of which can cause intense psychological experiences, colloquially known as trips. But this isn't always the case. These last couple of months, there is a growing interest in using these psychedelic drugs as a treatment for psychiatric conditions. This is nothing new, though, because in the 60s, people were already experimenting with this drug to treat mental health disorders. Alongside this interest in psychedelics is an increasing popular approach known as microdosing. Microdosing is when patients take a dose of psychedelics that is too small to produce any perceptible effects, generally between 5 to 10% of a standard dose. Despite the small amount of drug taken, there is evidence to suggest that microdosing can still bring about some of the benefits observed with full-dose treatment without causing the intense and sometimes negative hallucinatory experiences. Psychedelics are known to primarily affect serotonin, a chemical messenger that helps nerve cells communicate with other cells in the body. Serotonin is popularly portrayed in the media as being responsible for happiness, but in reality, its functionality is much more complex and widespread. In fact, serotonin is associated with not just mood, but also with cognition, sleeping, eating, thermoregulation, memory, and even physiological processes like vomiting. Since serotonin is so widely important in the body, there are molecular regions called serotonin 2A receptors located throughout the central nervous system. Chemicals can bind to these receptors in order to stimulate or block the serotonin system. Although this mechanism is not fully understood, these receptors are believed to be the targets of psychedelics. One hypothesis is that when these drugs bind to the serotonin 2A receptors, the brain cortex responsible for cognitive, sensory, and motor functions becomes excited, ultimately leading to hallucinations and other effects. Some studies have found psychedelics to increase neuroplasticity, which leads to the creation of more connections between neurons and could potentially explain the novelty of these intense psychological experiences. Microdosing is thus theorized to work in the same fashion, albeit to a milder degree. The results of the research that has been done till now is very promising. For example, 79% of respondents reported improvements in their mental health after microdosing. There has also been some animal research to back these survey findings. In one prominent study, researchers administered microdoses of DMT to rats and observed responses similar to those arising from antidepressants. Both microdosed and untreated rats were placed in a pool with no escape, and the microdosed rats continued swimming in an attempt to escape after the untreated rats had already given up. This suggests some degree of improved resilience and optimism in the microdosed rats. Another study microdosed some rats with psilocin, another psychoactive component of magic mushrooms, and others with a different psychedelic called ketamine, and found both to mildly alleviate anxiety in rats experiencing a stressful maze. Much more research needs to be done to understand not only how it works, but what the potential consequences and side effects are. If clinical trials confirm the safety and efficacy of microdosing psychedelics, these could represent a new avenue for mental health treatment. We like to show different sides of drugs and how it's able to help us in our daily lives. If you want to stay updated on the fantastic power of mushrooms, don't forget to subscribe.